Today we're going to talk about the Ayurvedic concept of pre-conceptional care. A healthy, beautiful, intelligent offspring is desired by all the parents. And the first step to this is the pre-conceptional care. After which there is the antenatal Ayurvedic care, the post-delivery care, which ensures a healthy, smooth, safe and painless delivery. It has tremendous benefits for the mother as well as the growth and development of the child, for the immunity of the child, for longevity of the life. We've discussed in detail in the part 1 video of Garbha Sanskar to replace the bad qualities with the good ones. Garbha is the fetus. Why all of these things are important, we've discussed in the part 1 video. This is a continuation to that video where we are going to talk about some important rules, regulations, do's, don'ts, diet rituals explained in the pre-conceptional care. If followed, it has beautiful results. Namaste everyone, welcome back to Jyovis. In the 21st century, due to the development of science and outstanding technical growth, there are a lot of benefits of course, but there's also a negative side to it. There is an increase in the prevalence of inhuman activities that is the major concern for the future generation. That is the reason you need Garbha Sanskar. A progeny with bad characters born even in the high family spoils the reputation of the entire family. All the problems, the hereditary conditions, the conditions coming from the mother, father to the child can be pretty much prevented. In the process, those problems are cured. Why? We are going to talk about it. Hence, the pre-conceptional care, the first step to this is very, very important. It starts with the body cleansing, the body purification, the Panchakarma, which is for internal purification. There are several treatments like Vaman, Virechan, Basti, Nastya, Raktamokshan from person to person as per their age, height, weight, their existing problems as per their various criteria. The Panchakarma is chosen. Raktamokshan and Uttar Basti, these are two treatments that are done if the patient is able to come to the center, to visit the center, because these are the treatments that are personally done by a skilled Ayurvedic professional. And these are the treatments that have tremendous results, about which we are going to talk about. If the patient cannot visit the center, the Virechan, Basti and the Aushadhi, the herbs are started. The Panchakarma, medications, diet, this entire process is extremely helpful. It cleanses the entire body, and the whole goal of this treatment during the preconceptional time is for Stri Bij Shuddhikaran, Purish Bij Shuddhikaran as well as the Mano Shuddhi. It has an impact on the Shukra Dhatu as well as the Arthav Dhatu. Problems like asthenospermia, which is the incurable condition for men. No medicine in the world for asthenospermia. With the male Uttar Basti, with certain Ayurvedic herbs, this can be completely cured. There are 50% chances that are said if a patient has asthenospermia, the condition can be cured if there are active sperms that are there in the semen analysis. Conditions like oligospermia, asthenospermia, male sexual related problems, the existing problems of male, these are covered up in the process of Garbha Sanskar. When it comes to the female, the PCOD, the stress or other hormonal related problems, hormonal issues, all of these are fixed in the process of the preconceptional care, the Panchakarma that is done. It is said that the couple should have maturity of all the dhatus, the 7 tissues. All the food that they take, it should be distributed well. From the Ahar Ras, every dhatu must get the proper nourishment. It is said that they should be free from diseases. In Ayurveda as well, whether the patient is for Garbha Sanskar, infertility, psoriasis, eczema, fungal infection, or a neurological condition, a gynecological condition, any of the condition, a Ayurvedic physician doesn't directly give the medicine for that particular ailment, for that particular problem. To see the long-term results, it's very important to balance the system. Goals can fail, system never fails. System has to be fixed, the root cause has to be fixed. The Vat, Pitta and the Kapha dosh has to be balanced. Once these 3 doshas are balanced, there is Mano Shuddhi, patient sees great results. Panchakarma, medicines, most of the things that are done, it has a great impact on the mind. Ayurveda looks at the human body as an inverted tree, where the roots of the tree is the mind, is the brain of the human body. Hence, utmost importance. It's like the CPU, where the brain is the roots and the branches, the body is below the brain, right? So utmost importance to the mind over body. When all these things, from this perspective, they are seen, patient gets the result of that particular treatment, of the particular rules or advices that are given by the Ayurvedic doctor. The second advice that is always given is celibacy. Celibacy to be followed for 3 months before conceiving. And a very important point to this is celibacy during first 3 days of menstruation. If the contact is kept, or if it is conceived in the first 3 days of menstruation, then the child, the fetus, has a high chance of developing various deformities. These deformities are explained in Ayurveda as skin diseases, blindness, deafness. It is also said that there could be intrauterine death, or if the child is born, he or she may have less longevity. A detailed explanation is given. Hence, avoid contact, keep celibacy, follow celibacy during the first 3 days of menstruation at least. This is often guided to patients while they come for Garbha Sanskar, an important aspect in the pre-conceptional care. Over here, prayers, meditation, certain books to be read, certain rituals to be done, all these are the guidelines that are given. The best time to keep contact for conceiving, it is the 12 days from the 4th day of menstruation. More than just getting conceived, it's about having a healthy pregnancy throughout the 9 months, a safe, smooth and painless delivery. All the complications being prevented, no stomach pain, back pain, nausea, vomiting, the gestational diabetes, blood pressure, thyroid, all these problems are pretty much prevented. That's the reason this entire process is important. The first step is the pre-conceptional regime. Observance of all these methods ensures Stri Beat Shuddhikaran, Purish Beat Shuddhikaran, as well as the Mano Shuddhi. It also purifies the uterus, the Uttar Basti, the Rakta Mokshan. All these have a great impact in purifying, in cleansing the local part. For example, Uttar Basti, we have several images of male and female Uttar Basti. We can add images over here, but it's just that the video will just get banned for Jyovis showing unethical or wrong content on the platform, right? So male Uttar Basti, female Uttar Basti, if you're following us on YouTube, you'll see certain images of these two procedures. What are the results, certain before after in cases of the uterine fibroids, the ovarian cysts, the PCOD, and all these conditions pretty much managed, pretty much cured with the help of authentic Ayurvedic treatment. So whether it's the infertility, whether it's the healthy pregnancy, there are a lot of aspect, a lot of nutrition, nourishment that a mother requires beyond just calcium, iron, folic acid, about which we are going to discuss in the antenatal care regime video. So make sure you subscribe to Jyovis, do like and share this video further. If you have any doubts or questions, let us know in the comment section below. This is all for now. Until next time, from Jyovis and the team, look impressive, be progressive.